An IPA is an independent practice association or independent physician association. It is an organization that allows physicians to come together and collaborate on different ways of providing better quality health care.
What I see as the IPA is a central location that will allow physicians to negotiate deals on supplies and services for their facilities, whether it's private practice or at a hospital setting, but also beyond that, communicating patient results and health information on patients in a broader spectrum so we can get a handle on how procedures are being done here, how patient care is being handled here in the state.
Because it allows physicians to remain independent, it allows physicians to collectively negotiate with payers, of which we have very few in Wyoming, and they wield a lot of market power. It's become very attractive to the WMS to try to help set one of these up in order to counter that consolidation. There's no magic formula for how far an IPA has to be either clinically or financially integrated in order to be effective. It really depends on the goals of the IPA as well as what the members are willing to do. If you want to be an IPA that is able to negotiate on behalf of its members with payers, then more integration from a financial or clinical point of view is going to be required than one that simply wants to negotiate non-price terms with payers or simply improve the quality of care that its members are providing. It really is a flexible organization. It's a flexible vehicle.
Well, we're putting this together to help the physicians. I mean, that would be the ideal situation, to help a single practitioner or a small practice group that really doesn't have the ability to negotiate prices very well with suppliers and doesn't have the ability to get the high technology systems in a cost-effective manner. By having a larger group, this will really benefit that type of individual. The society is not in the business of running everybody's practice. That's the last thing we'd want to do.
An independent practice association allows the practices to remain independent of each other. The only integration is to the extent necessary to achieve its goals. The WMS at this point has been considering the idea of facilitating an IPA for quite a while. It's not a new idea. An IPA is a structure that's been around for several decades.
Well, the Wyoming Medical Society represents all physicians here in the state, and I think having a central facility such as the Wyoming Medical Society that has worked with all physician groups, has worked with insurance companies, and has a great relationship with all of these individuals across the state, makes them the ideal source to help get this going and get this off the ground.
At this point, the WMS has gauged the interest of its members. It's continuing to do that in forming an IPA. And interest level has been pretty high.
Well, there's no commitment at this point. For right now, we're getting a general interest level and finding out if physician groups would be willing to participate. There would be fees associated with this. Obviously, there is a cost associated with running an IPA, but hopefully that cost is minimal compared to the savings that a group would realize on the purchasing side of things.